Welcome to everybody to the Norfolk and Suffolk Care Support Care Provider meeting. And just to remind people that haven't joined us before, that Megan will record this session, so it will be available for people afterwards, for people that haven't joined or that had to leave and wanted to find out something later on, for example. We run these care provider meetings 3 times a year. And the intention is that we invite people to speak to you from things that you've actually asked us about in the past. So we often ask people what they would like to hear most or in the session. So it's based on that feedback as well. So I'd like to say thank you very much to everybody that's attended. I want to introduce my team first before we go on. I'm not going to introduce everybody in the room, because we've got a lot of people here today and that would take an awful long time. But when you do join us, if you want to ask a question or you want to come in the chat box, please could you put your name and organisation so that we know where you're from? That would be really helpful. So thank you for that. As Megan has said, if everybody could just mute whilst we're going through the presentations, that would be fantastic. Whilst we're going through the presentations, if anybody has a question, you can either put your hand up, and there is a little icon for hands up. It will depend on your device as to where it is. So it could be on the top bar under reactions, or it might be on the bottom part of bar. So we can't really tell you where to find it. If you are having trouble finding your hand button, you can come on video and wave to us, or you could just put something in the chat box saying you'd like to come in. Welcome, Sunita and Greg and everybody that's putting their names in the chat box. That's wonderful. And Sharon. So yes, the chat box is there for you to communicate with us during the meeting. So without further ado, my name is Christine Footer. I'm the Chief Operating Officer of Norfolk and Suffolk Care Support. And I'm just going to go round in the order that I can see you in. So Phil, would you like to introduce yourself?
Good morning, everybody. My name is Phil Tilney. I'm the Social Care Careers Ambassador for the company.
Thank you, Phil. And Pete?
Hi, yeah, I'm Pete Alder. I'm the Information and Communications Executive. So you probably see my name when you get the twice a weekly e-bulletins. If you don't get the e-bulletins, shout, because you should do.
Thank you, and they are extremely important and helpful. And Megan.
Yeah, hi everyone, I'm Megan and I'm the Communications and Admin Executive at Norfolk and Suffolk Care Support.
Thank you, Megan. And Megan is absolutely brilliant with this. She'll help us through all the technical stuff as well with all the presentations. We've got, thank you everybody for putting your names and your provider details in the chat box. That's absolutely wonderful. Thank you very much for that, and welcome everybody. We've got some people here today which we will be introducing, so we'll be going through those as and when the presentations come up, but welcome to you who've already joined us as well. So I think without further ado, we can go through the agenda so you can see what we're doing today. We've got a presentation to begin with this morning, which is from our organisation. So we shall be doing that first. And then we've got Nick Clinch and Christine Breeze, who are from Norfolk County Council, the ICS as well. And they will be talking about the integrated care system and the structure and what that looks like and what that means. And then we've got Suzanne Baldwin, who I'm sure you're familiar with. She's been to a few of these provider meetings, but also is involved in much of the work around the quality improvement and so on. So she'll be talking with Stephen Long as well. Unfortunately, Tim Weller can't be here today, but issues relating to quality and the escalation policy. And then we've got a few little things to do at the end of the meeting, including our Mentimeter, which we do enjoy getting information back from. So that'll be something to look forward to towards the end of the meeting. So thank you very much for that. I think we can move on to our presentation. So, oh, we've got, right, let me just admit him. That's great. So without further ado, we shall go on to our presentation. So these are the updates from Norfolk and Suffolk Hespel about projects that we're currently involved in or supporting or running ourselves. So I'm just going to bring in members of the team to talk about the projects that they're involved in and what's happening, but also for you to be aware of. And if any of you aren't aware or are interested after the discussion, then please put some details in the chat box. So Pete, without further ado, over to you.
Hi, yep. So really quickly, one of the projects that we're involved in that you might have heard from me numerous times and seen in the bulletin is called Better Security, Better Care, and we are funded to provide support to the care providers in Norfolk to complete what's called the Data Security and Protection Toolkit. I won't go into details too much about it. As you can see there, 72% of care providers in Norfolk have already completed the toolkit and are compliant, which is one of the highest percentage rates for a council in the country, which is they're good. So we're really pleased with that. If you haven't completed the toolkit or you don't know what it is or you're not sure whether or not you have to because your head office might do it on your behalf, any questions that you've got about the toolkit, let me know. It's a free online toolkit that you can work through, 42 questions that gets you thinking about your policies and procedures around data security. And we provide half-day training workshops around the subject. We've got one this afternoon. We have 2 of those a month. We have bite-sized webinars, and we can provide one-to-one support from me where we can jump on Teams, or if necessary, I could always come out to see you to work through how to register and get yourself set up and completing the toolkit. So we've got this support. It's all free, fully funded, right the way through until at least April next year. So that's good. Interesting, Raj, I just say about CQC asking about the toolkit. It's not compulsory, but CQC are keen for people to do it as a way of evidencing that you have good policies and procedures. So yep, that's my bit with that. Get in contact. Any questions about the toolkit, pop them across to me.
Thank you very, very much, Pete. And just to reiterate that Pete can do one-to-one sessions, can come out if necessary. So please just get in touch with us. The feedback that we've had from providers, from Pete's support, and also White's training as well, that's helping us with the project, has been really good. So we're just here to help you. And as Pete says, we're one of the best in terms of compliance in the country, and that's a huge achievement. So we just want to keep on improving and get to the rest of the people that haven't quite done it yet. So yeah, thank you, Pete, for that. Was there anything else anybody else wanted to add to that? Megan, did you want to add anything? Because I know you've been supporting as well.
The only thing I added was that I've popped the email in the chat. So we do have a dedicated help desk email that Pete does pick up, and myself sometimes when Pete is rarely allowed out of the office to go on holiday. So do email that one. It's helpdesk@norfolk-and-suffolk-caresport.co.uk. And I think Roycin has popped in the chat as well that you'll need to complete the toolkit to enable you to get proxy access for online ordering, which is a very, very good point indeed.
Yes. Thank you. Did you want to say anything about that, Pete, as well?
Not really. No, that's one of the things that we cover in the training. Say it's not compulsory, but there are certain contractual. If you contract with the NHS, like continuing healthcare, you do need to have completed the toolkit, proxy access to the medication. So there are certain reasons that you do have to have done it. generally you don't. It isn't compulsory. Some areas in the country are getting the numbers of compliance up by really, implying that people have to do it. We've managed to get to 72% by being really honest with people and just saying that, it's not compulsory yet, but we think that within a number of years that may well change. Some local authorities are looking at making it compulsory. The toolkit's mentioned in the recent white paper as being a thing that they want care providers to do. I think that that's probably the direction of travel. So so the remaining, my maths isn't very good, is that 28% providers that haven't done it yet. Get in there now. And to say, if you don't know whether you are one of those 28% or one of the 72%, just ask me, because I can tell you within seconds.
That's really helpful, Pete. Thank you very much indeed. Okay, then, so let's go on to the next slide. Thanks, Megan. Okay, and did you want to talk through this, Megan, and the wellbeing offers that we've got?
Yeah, absolutely. So me again. Hi all. So at the moment we are running 6 sessions of wellbeing support. As you're probably aware, we have been running these sessions now for coming up to 2 years actually, for various different topics. And this last batch of sessions that we have had funding for are running up until the end of the year. And we're releasing them in bulks of 32 sessions. So we're on our second bulk, as it were. And these sessions run from August to October. And then we'll then release our last bulk, which will run from October to December. So the sessions themselves are focused on the idea of recruitment and retention of staff, with the sort of overarching theme of wellbeing. So a number of the sessions focus on team leading, as well as those who may be aspiring to go into management roles and managers themselves, but also a lot of them do revolve around the actual team themselves. So we have a variety of different sessions available that people are more than welcome to come along to. As always, just email, and I'll pop the email in the chat when I'm done speaking about it, and we can get you booked on. There's a variety of different dates and times. We've listened really intently to everything that we had fed back from all of the other sessions. So there's a lot of opportunities to come along to these, and they are only 1 hour. So we've sort of aimed them to be possible for as many people to come along to, and we're not doing too many stoppages on how many people can come along to these. So please do just book in. We've had brilliant numbers so far and fantastic feedback, and certainly a lot of these sessions, especially around emotionally intelligent leadership and having difficult conversations, we've had some of the best feedback we've had for wellbeing sessions. So they're definitely one to go along to. And I think it's me again, so I'll just I'll go on to the videos if you want as well, Christine.
Yeah, I was just going to add, Megan, as well, around the wellbeing sessions, that these are available for staff as well as yourselves, but it's really important that people are aware of this. And one of the things that we're often asked is, how do managers communicate this information with their staff? So it'd be really useful to get some feedback, maybe in the chat box, about how you contact your staff to let them know about the training. I know, for example, we've had some feedback from some providers from surveys that we've done in the past that say they go through newsletters, they put it on their staff board, they talk about it with their staff supervision. It'd be really good just to have some idea on today's session about how you notify your staff about training that's available. And this wellbeing training, as Megan said, we've been doing this for nearly 2 years now. We've got some fantastic numbers, so we know that providers are talking to their staff about it. But it's really helpful for us to know that that information is getting out, and the best source of that information. So if you could pop some stuff in the chat box, that'd be great. Thanks, Megan.
That's all right. Yes, we're well over 1,000 now, people who have accessed our wellbeing services in terms of our online training. The other thing that we're doing, as I'm sure all of you are aware, because I mention it whenever I can, I do have a film degree, and we use that wherever we can possible in Norfolk and Suffolk. So last year we did do 3 bite-sized videos which were all about wellbeing. Progressive muscle relaxation was one of them, which has got the most views at the moment. And again, I'll pop some links of those into the chat rather. We are doing 6 more, all around emotionally intelligent leadership, which is a bit of a focus for us at the moment, and that will be going into great detail. So those sessions can be accessed either individually or as part of a group of sessions that you might want to put in as a group of e-learning sessions. They're only 15 minutes long. I think one of them's 17, but other than that, they're 15 minutes long. They're really useful just to drop in and out of. And there's something that can be on in the background while people are at work. So they're really helpful resource and something that we're quite passionate about. So if you do have a chance, I'll pop those links in the chat, and hopefully you can have a look at some of the videos. And as I said, we've got 6 new ones, which should be released by the end of the year.
Thank you, Megan. I think, have you popped that as a link in the chat box, or is that something you said you're going to do?
I'm going to do it now. My multitasking is not that strong, so I'll do that now.
Oh, it is, Megan, it is. Thank you, Megan. It's just a useful, easy link for people to access those videos that, as you say, they've already been opened by a substantial number of people, but just to make them more widely known and available. That's fantastic. Thank you, Megan. And now on to the next slide.
Me again.
Yeah.
Hello all. You're gonna be sick of my voice. So yes, this the next slide we're talking about is, or the next project rather, is about dementia training videos. So you may have seen we have released our first suite of dementia training videos, our first 5. We've had some incredible views on these already, and equally some incredible feedback on them. So the dementia training videos themselves, there's going to be 17 in a series that aims to look at the entire pathway of a person who has dementia and how they are supported start to finish. So the first 5 videos that we released were all about depression, delirium, nutrition and hydration, non-pharmaceutical psychological intervention, managing distress behaviours, pain and dementia. The next 5 that we are putting out are, we've got 2 videos on safeguarding, one specifically for dom care and one specifically for residential care and the differences therein. We have our end of life care, our respect form and end of life care video, and we also have another one which I think is on continence, I think is our next one that's coming out. So they're a real mix and variety of different speakers as well. We've had speakers from across the CCG ICS as it is now, and from across the voluntary sector and social care itself. So they're really, really useful. They're experts talking in their field. They're free to access. Anyone can access them. And the whole idea around them is that they will provide the opportunity to have a standardised form of dementia training for all adult social care. So people in those videos can understand what is the current standard for dementia care. All of the videos have been created with questions from providers. As you will have seen, I've been putting out surveys and requests, as well as that case studies from providers, so they are a truly local resource. You will see these videos popping up on a number of other information sites. We've had a lot of interest from health and the NHS for these type of videos as well. So I'm sure, and I think the quality team wanted to send some out as well. So you'll get them everywhere possible. They all link you to the same page though, which is our YouTube page, and all of the links are available on our website, and I've popped those. Oh, these are great. Thank you, Emma. They are great. I am biased, but I do agree. But yes, we've got 4 more videos coming out. I think in the next couple of weeks. And then after that, we've got the rest of the videos. They're going to come out in increments of 4 or 5 throughout now until the end of the year. So we're very excited. Specifically, the one I'm most excited about is we're doing a fantastic project with the Norfolk and Norwich University Hospital, where we are going and filming for a whole day, talking about what a person with dementia experiences when they go into hospital and how best to support them. So they're a really, really positive resource, and we hope people will watch and use them. They've got some fantastic views. So yeah.
Thank you very much, Megan. And just to say, this is a truly collaborative piece of work. It started with a discussion that I had with Zena Aldridge, Dr. Zena Aldridge as she is now, and Dr. Liz Waddy, and it was around some funding that they had that was available for the system. The priority was given to social care because of the amount of work that takes place in this sector around dementia care, and so as a result we looked at what was already in existence, but the framework standards that have been out for some time, and about how we could produce some support, some training that was easily accessible, but relevant, completely relevant to people working in the sector. Hence, as Megan has explained, that's why we came out to you for questions, queries and scenarios, so we could base some of the theory around the practical issues that you're facing day to day. They are from local experts, as Megan has said, in this field, including psychologists as well, research, and also people such as Zena, who's just completed her PhD. So it really is an excellent resource, which we're very proud to have worked together on. So we want to make sure that people are aware for their staff and can use this for team meetings, for access, for if they're doing, for example, if they're doing a qualification or an apprenticeship or something like that, and they want to do some research, they can access these videos to support that qualification they're doing. It can also be used as standalone and CPD, even for regulated professionals. They can use it and reflect on it and discuss it, etc. So very, very pleased to have been involved, but also really want to promote this to maximise the benefits that we saw could be derived from doing it like this. So thank you. Yes, you're quite right, Megan. Zena is absolutely passionate about this, and for some of you, you may have known Zena in the past, or have even had Zena in to speak to you about dementia in your services. So it really is a very practical, but also research-based, theoretical, expert advice that's there in the sessions, and we're, as I say, very, very proud of this work. Okay, on to quality, strategy and safeguarding. Megan, you can breathe again.
And I'm back. So as I'm sure you're all aware, and it was fantastic to see so many of you involved in the quality strategy meeting. I think that was last week. The weeks have all gone into one. So yes, it was only last week. We're going to go into a little bit more detail on this later. Susanne is here now. I've just seen her join, and she'll be speaking a little bit about that session. But leading on from that, Norca and Norfolk and Suffolk Care Support are working with Norfolk Safeguarding Adults Board to focus on safeguarding in terms of quality. I can spot a couple of people, and I can see Sarah up there as well, who came along to one of our last focus group meetings. And we are holding another focus group session on the 25th of August. These sessions are designed that providers can come along, give ideas as to what's working well and what isn't working well in regards to the safeguarding system across the whole spectrum of safeguarding, and look at how we could potentially assist in resolving some of those issues. We had some fantastic feedback from our first 2 sessions, and leading on from that, we are now opening up a wider session on the 25th of August. There is an email there to book, and I'll pop that in the chat as always. And that session itself will look at what's sort of been raised by our smaller focus group, and looking at now opening up to a bigger group of more providers. At the moment, we've got 18 booked on to attend. We've got 12 more spaces, so do hurry if you want to book onto that. Because we are going to limit the spaces to 30 just so we can do as much discussion as possible. And we're very, very pleased to say that it's a face-to-face session. So there's an opportunity for a cup of coffee and a biscuit, and then to actually see each other face-to-face, which has been lovely. Lovely to put some faces below the head and neck to names. So yeah, it's been brilliant.
Yeah, thank you very much. And it was really lovely to see people last week, wasn't it, Megan? At the Willow Centre, I would say some people were literally skipping in the room because they were so pleased to have a face-to-face meeting. So really good, and some excellent feedback, which we're working on with Walter and Becky for our next session. So thank you, Megan, for that. On to the next slide, I think. Yes, this is the care worker framework. So just to make people aware that we've been working with an organisation called Inecto, which are a HR specialist organisation, to look at this care worker framework. This is a benchmarking tool. So the idea is that you could look at jobs across social care and benchmark them according to skills and knowledge. This is something that we've been discussing within the whole sector for a long time, and including Norca as well, about how useful it would be in terms of providing information and evidence to demonstrate the skills and knowledge that already exist in the sector. So this is a piece of work which is under development at the moment. You'll see here that what we've done so far is we've worked with Inecto to look at information across the sector. So we've gathered things like job descriptions and information that we can use from jobs. We've done some analysis around that, and then we've devised a framework to sort of to explain how they sit within this framework. And the idea really is to ensure, oh sorry, I've gone past that, is to ensure that we can have a similarity across the whole system. So we're standardizing the jobs across the system. This will enable us also to overlay it with things like in the future pay and qualifications and so on like that. But at the moment we're just finalizing the details. We're getting back more information from people in terms of feedback, and then we're going to put this online, so on a website, so that you'll be able to use this for your own organizations, and the whole idea is for social care to have an understanding of how it fits within the wider system. So we should be able to overlay it with things like health and the agenda for change and things like that in the future. So it's in development at the moment. We've got some excellent feedback again from the sector on this, which has really helped to develop it. And again, it is Norfolk and Waveney and providers in Norfolk and Waveney that have supported us to develop this particular framework. I have to say we've had some really good feedback as well from other parts of the country as well, so regionally as well, from places like the ADAS group, and I know Susanne is on the call here today, that have been really interested in this and want to take it up potentially regionally and maybe even nationally. So it's a well respected piece of work. It's still, as I say, in development, but it is a significant piece of work in terms of placing social care within the wider sector and for people to understand the skills and knowledge that we have sitting in this sector. Megan, did you want to add anything to that, or do you think I've left anything out that you wanted to sort of raise awareness about?
No, the only thing I was going to say is we have met with MPs as well, who have been very, very keen on this and keen to get it further socialised throughout both our local area and beyond. And the idea of the website is to make it as accessible as possible. So it will be something that you can use the website itself as a tool to complete the framework. So it's in the process. Do bear with us, as I'm sure you're aware these things take time and development, but yeah, we are working towards that. Which MPs have engaged? Oh, I don't know. Well, we're in talks at the moment,
Baker.
Raj. So yeah. Duncan Baker.
And he's talking to other MPs as well as a result of that. So yeah, so on to the next slide.
So I think this is Phil.
Good morning, everybody. Yeah, let me tell you a little bit about the Earn As You Learn. Can everybody hear me okay?
Yeah.
Yep, great. The Earn As You Learn. So we're working in connection with several colleges at the moment, City College, East Coast College, and also Paston College, with the health and social care students that are doing their level 2s and level 3s. Many of the students are looking for part-time work. So rather than them working in Asda or other supermarkets, there's the opportunity for them to come along and work part-time, as you said, with yourselves. These are not placements. These actually are going to be staff members that you recruit through your normal policies and procedures, and they become part-time staff. Many of the students are available during the week, but also weekends as well. And we do have a number of students at the moment working with providers like yourselves and supporting them while your existing chorus staff are away on annual leave. It's a great benefit. They're obviously, what we do, our part, we have an expression of interest which the student completes. I then call the student and talk to them, find out a little bit more about their interests, whether it is in nursing homes, residential homes, day service, or domiciliary care. And then what we look is for their location, and then we match them up with providers within that location. So the idea is so that they don't incur great expense for travelling, which helps on reliability as well. And I then contact the provider in the area and talk to you about that member of staff or that student potentially becoming a member of your staff. And if it's something that you're interested in and you'd like to pursue further, maybe get in talks with the student, I then link you via email to the student, and where you can then obviously have a chat with the student, find out a little bit more about them, ask them along to attend maybe an open day or just a time that fits with yourself where you can meet them and talk to them a little bit more in more detail. As I say, it's not a placement, and it is where they become paid members of staff. If you're interested in finding out more, then please do email me. I'll pop my email address into the chat box where we can go into more detail and explain a little bit more about it if you'd like to. Thank you.
Thank you, Phil. Thank you very much. And we're coming on to the final slide, I think. Is that right, Megan? Yes, this is the final slide. Developing skills in health and social care. So this is really just a reminder for people that there is this European social funding, developing skills in health and social care. So it's for people in work progression. So this is available for all staff. There are courses which are accredited. So in other words, this contributes towards a qualification. There's a range of different options there, from mental health, dementia. There's functional skills as well. So the whole offer is available on the website, and we've got links to that as well. We definitely have got the funding until next year, so August, September of next year. If anybody wants further information, then please do get in touch. We've got the website available, the links to the website available through us, or if you just wanted to talk it through, there are numbers to talk it through with at the at the project team. We have connected quite a lot of people with the program already. I know, Raj, you won't mind me saying that we've been talking about the international recruits as well, because one of the issues has been not being able to access training if somebody hasn't had residency for 3 years, particularly, say, for example, apprenticeships. Whereas with this, there you are able to access this training. So again, if, for example, you've recruited internationally and you're worried or concerned about where to find some support in terms of training, you can get some through this ESF program as well. So I would very much suggest that people have a look. It's only going to be available till next year, but it's got some wonderful courses available. And if you've got aspiring managers in particular, there is an aspiring managers course on there, which is very popular and probably the most attended course on there. I think Suzanne would probably nod and agree with me on that one. But yeah, there's some fantastic opportunities there, so please do. Oh, thank you very much, Megan, you've popped it in the chat box. Please do have a look. Just very quickly, the person on this slide is a lady called Epi Dawson, and she is one of our trainee nursing associates, soon to be a registered nursing associate. I'm just going to go back to Phil to mention very briefly about the Trainee Nursing Associate Programme.
Again, I've spoken to quite a few of you in the meeting about the Trainee Nursing Associate, and also there's many of you that I haven't, but it's a level 5 regulated qualification. It's where your member of staff does get a day release with the UEA. There are other universities available as well. West College of Anglia is another who is supporting the Trainee Nursing Associate Programme. There's many benefits to the Trainee Nursing Associate Programme. I could be here all day actually talking to you about it. Something that I'm very, very passionate about, and as well as Christine as well, is something that we've worked considerably hard on. We can help and support with all the information and questions that you may have. Levy transfers as well is something that we can assist in and support you with. We can take all the hard work away so that we actually support you with your members of staff. So if you've got members of staff that might have had gained their level 3 qualifications and that they have level 2 maths and English in place or equivalent, if they're from overseas, then please contact us and we'd be more than happy to talk to you and support you through this process.
Thank you very much. It is about the nursing workforce. These people, the trainee nursing associates, after 2 years will become a registered nursing associate with a PIN, and they are part of the professional nursing workforce. It's, as Phil says, a regulated profession, so it's registered through the NMC. So again, it's something, if you're interested, please do get in touch with us. Thank you. And I think we're on to our last slide.
Well, our last slide is about our survey. So I'll pop that up at the end, our survey, as well as our Mentimeter for everyone.
That's great, Megan, and we'll return to that at the very end. So thank you very much. So that's all from us, but please do contact us about any of the information that we've shared with you today, or if you've got any interest in any of the projects that we're doing, please either email us, ring us. That's absolutely fine. We're here to talk that through with you and to connect you with anything that you will find important or necessary or helpful. So thank you very much for that. So we're on to our next item on the agenda. Unless anybody else wants to come in at that point and just ask any questions about the information that they've been provided, I suppose I really ought to just say that first. Is there anything that anybody wanted to clarify or ask a question on from the presentation that we've done? Emma, okay, thank you. Oh, that's brilliant. Yes, that's great. Fantastic. Thank you very much as well, Emma, in the chat box. Around the information that you said about the dementia videos and how you're using them. That's really interesting and excellent. And thank you for those that have explained how they contact their staff. Thank you, Sarah, for putting your comments in the chat box too. Really helpful, thank you. Raj, just in terms of the MPs and the care worker framework, Norca are doing that, so we'll be doing that as a board and going out to all MPs around that, because that's our piece of work with Norfolk and Suffolk Care Support, so we'll be doing that, so that's fine. Thank you. Thanks, Raj. Excellent. Okay. All right then. So we're on to our next presentation, and I do believe that's Nick Clinch, and I haven't seen, is Christine Breeze here as well?
Hello.
Oh, hello, Nick.
Hi.
I
It's
knew
it's
you were
just
here.
me. So
It's
yeah, Christine is off today. So you've got me. Hi everyone.
okay, Nick. Shall I pass over to you then, Nick, to introduce yourself? And I presume you've got a presentation. I'm sure
Yes.
you must have with that diagram. Thank you.
Lovely.
I'll send over to you. Thank you.
Yeah, thank you, Christine, and hi everyone. So I'm Nick Clinch. I'm an assistant director working across health and social care. So between Norfolk County Council and the Integrated Care Board. I'm really delighted to be invited today. I really enjoyed those slides. That was really interesting, and there were a couple of themes within there about the framework and dementia that actually feed quite nicely into the presentation I'm about to take you through about the integrated care system. So I'm just going to bring up some slides on screen. That the idea is we thought it'd be helpful just to talk a bit about what our integrated care system is in Norfolk and Waveney, but with a particular focus on the importance of it to social care and care providers. And then we're going to highlight a particular part of the ICS, which is how we work together at place. And I'll explain in a moment what we mean by places when we're talking about health and social care in this context. So I've tried to make the following slides, those 6 of them, as interesting as I can. There is some really important stuff in here overall about how, as care, we engage with an ICS. So really encourage people to give this some thought as we go through and kind of soak in some of the changes that are now happening about how health and social care work together. So I've just started a bit of the basics, and apologies to those that will have seen versions of this before, but I think it's important we just remind ourselves what an integrated care system actually is, because obviously there have been quite a lot of changes in how health is structured, and this is the latest one, but potentially one of the most significant. So integrated care systems, so ICSs, are effectively a group of it's a partnership of organisations that work in health and social care that come together to plan and deliver joined up health and social care services for people who are within their area. And when we talk about the partners in that, it's not just NHS partners, so care providers from a community health or acute sense or primary care, but it's also explicitly local councils, both county and district in our area, as well as social care providers, voluntary sector. So for the first time from a statutory sense, it really is bringing together a wider range of partners to look at health and social care in a more formal way. And they are now, as of July, responsible. They have that legal responsibility now for planning how most health services are delivered across England, and how health and social care work together. And I've included on the right a diagram that just helpfully explains the kind of 4 key purposes of an ICS. So it's about improving population health and healthcare, tackling inequalities, enhancing productivity and value for money from an NHS perspective, but also importantly, broader social and economic development. So not just about people's clinical health, but their health and wellbeing overall. Now, conveniently, the Care Provider Alliance have released last week a really helpful document that explains a bit about how care providers can play a role in ICSs. And I've just highlighted a few of the things from there that I think are really interesting about why potentially an ICS, it seems on the face of it that it's a change about how we govern ourselves and how we structure, but actually care providers have a really potentially vital and exciting role within them. So obviously as care providers, you'll know this, you have that real experience in how you maximise resource and design and deliver services every day, but around local people who are within your communities. And I think that's a really important part of something that ICSs want to do more of and can build on the experience that you all have, and potentially other parts of the NHS don't. The social care provider sector is a major employer within every integrated care system. We can't forget that. Workforce, from a social care perspective, sits really within your organisations, and we want to make sure that within an ICS that's understood and planned for collectively. And that also social care providers, you bring expertise, as does social care overall, on both kind of how we do preventative approaches more, so not just about treating people's illnesses when they become unwell, but communities in a way that some other parts of ICS don't. And really that the thrust of what the Care Provider Alliance are getting at is that the most successful ICSs will be those that really embrace adult social care and children's social care, and bring them into their ICS in a really meaningful way. So that's just a recap of what ICSs are about. And so for our area specifically, our integrated care system is Norfolk and Waveney. And this diagram just lays out at the highest level what the structure of that is. So there's a Norfolk and Waveney integrated care system, which is the box at the top, but it's made up of two parts. So from an NHS perspective, there is the Integrated Care Board. So some of you will have worked before with clinical commissioning groups. They no longer exist as of July. They've been replaced by the Integrated Care Board, which is an organisation. Confusingly, that Integrated Care Board has a board itself, of which is mostly made up of NHS partners, including acute hospitals, community health, but also does have adult social care representation on it. And the idea of that board, it's for all of Norfolk and Waveney, and it's about bringing together the NHS all in one room, and responsible for NHS performance and finances. It also does some then, because adult social care is there as well, gives us a voice in that room in a way that potentially we haven't had before. Similarly, then at a whole system level, also for the whole of Norfolk and Waveney, is the Integrated Care Partnership, which doesn't replace our Health and Wellbeing Board, but has the same membership, is a statutory committee of the NHS and the county councils. And that's where all partners within the integrated care system come together, including care providers. So Norfolk Care Association, Christine is sitting on the Integrated Care Partnership, but also includes voluntary sector, district councils, police. There's a really wide range. It's everyone really responsible for the health and well-being in its totality. And then below that, the bit that I really want to focus on today is at place. So when we talk about place, this is really the more local communities that sit below a Norfolk and Waveney level. So the bit I'm going to talk about today are these local health and wellbeing partnerships. So these are new. There are 8 of them, so they're on the same boundaries as district councils, but they're not district council meetings. They are everyone's meeting who works within that area. And they bring together then at the local level all the partners involved with health and wellbeing. And the idea is that they should be setting a local strategy for their area about how we support people's health and wellbeing overall, and bringing together all partners. And so I've included there some of the kind of members that are on that group. But again, it explicitly includes social care, both from a county council perspective and from a care provider perspective, which we've agreed will be there, which is a really exciting development, because our previous structures that brought people together in that way have not included care providers within that. So it's quite a significant change. And for information, there is then an equivalent. So on the NHS side, there are 5 different geographical boundaries, which is slightly confusing, but is kind of where we are, which are about bringing together NHS functions predominantly within a local area, about operational delivery. So less about setting strategy and more about how does health work with itself, and to a certain degree our social care teams within an area. So that's the structure. And when you get a copy of these slides, it's helpful just to have a look and familiarise yourself, because it is a little bit complicated, but it lays out the kind of importance of it. So the bit I'm going to talk about now are these health and wellbeing partnerships, so where we all come together in local areas as partners. So the reason they're important, so there are 8 of them, as I say, is that the whole purpose of them is about bringing together our communities in a different way, jointly planning things together in a way between health and social care that perhaps we haven't done as much of as we should have done before. Focusing on the wider impact on people's health and well-being. So not, as I say, just about clinical impact, but about how people's local economic factors, the cost of living, all has an impact on people's health and well-being. And then finally, about how we plan and use money together within that local area, so we make best use of resources. That on the face of it seems quite high level, but I've given a real specific example of why these are potentially important. So these meetings, the 8 health and wellbeing partnerships, have now only been up and running a month or two. But already what we found with them is that there is a real opportunity for social care in its widest sense to gain some value. So as an example, there was a bid from Norca that went in working together with Norfolk County Council for funding to be allocated for care academies. And I think the majority of the health and wellbeing partnerships have now allocated funding specifically for care academies this year. Which is a really significant development. It's a significant amount of money, but what it shows is that those health and wellbeing partnerships aren't just prioritising health and social care in the traditional sense. They're thinking about care providers and thinking about how we can do things differently together, because they appreciate that things like care academies have an impact on all these different areas of what they're trying to achieve. So that's why they're really important that we make the most of them. And so this diagram just shows where they are. So I appreciate some of the text on here is a little bit small, but just as an illustration, if you look at the North Norfolk area, there are 2 health and wellbeing partnerships, a North Norfolk one and a Broadland one, so on the same boundary as the district councils. And going to those, which I'll just kind of highlight on the next slide, are representatives from Norfolk Adult Social Services, so an operational colleague and a commissioner, but also Norca are going to both of those, and that is replicated across the whole of Norfolk and Waveney. So we've got adult social care front and centre on all of the different groups. I've also put on here the boxes in blue are the NHS place boards that I mentioned, just for people's reference, where we've also sending a adult social care representative. But as I say, this just visualises where these meetings are and what areas they cover. So the last couple of slides, we just want to talk a bit about, I guess, from a Norfolk County Council and Norca perspective, what is our ambition for what we want from the integrated care system in these places. So Norfolk County Council has committed to making sure that we are an active leader within our health and social care system in this new structure. So really making the most of a kind of fresh opportunity to get social care front and centre in how we think about health and care overall. And there are 5 kind of ambitions for that hopefully you'll see kind of replicated in that push that we're making to be on those health and wellbeing partnerships. So we want to use them to really build better trust and relationships at that local level between health and social care. And there are wicked issues, so things that are particularly difficult, such as workforce, we know, to deliver really transformational change on. There's everyone coming together. We want to use the ICS to really address some of those main challenges. Then the other couple I just highlight here is that we think that there's an opportunity to engage better with our local communities, and that's where I think actually there could be a really important role for care providers. So as an example, we've been discussing about the role of local councillors in having a more prominent role on those health and wellbeing partnerships, which they actually chair, to kind of be the voice of local residents. I think there is a real opportunity there for care providers as well, because as I've said in the earlier slides, your local communities in a way that a lot of other parts of health and social care don't, maybe with the exception of general practice. So I think we need to think about, is there an opportunity to do something differently? And lastly, but not least, is that from a county council perspective, we really want to see strong leadership in the ICS from a social care perspective. So our voice as social care is really there and really important. So then lastly, I just want to highlight, I guess, Norca's ambition in the ICS. If you don't mind, Christine, I'll just whiz through it, and if you want to then add anything that I've missed. So we've had between the County Council and Norca, a really good discussion about, within that structure I ran through, how do we make sure that not just adult social care from Norfolk County Council, but care providers are really represented there with an aligned voice, but that you have your own voice as well in those meetings. So what we've agreed is that Norca will go to all of the health and wellbeing partnerships. So there's 7 of them in Norfolk and the 1 in Waveney. And the reason for that is because of their focus on health and wellbeing, which feels really important to the sector. So we're currently actively identifying. I know that Megan has been going to all of them, I think, so far, which is quite a few, but is doing a fab job at there. So there will be colleagues that will be identified to go to those partnerships. Adult social services are then also attending, as the picture showed earlier. So we've got a commissioner and an operational colleague at all of them. And then the idea is that Norca and NCC will make sure that all the partnerships have included us on their terms of reference, so we're front and centre there. and that we will try and have a consistent voice on what the aims and challenges are and opportunities for social care. So although we may have different views on priorities and approaches, we have, as far as possible, one social care voice, which will be the first time we really have that within the integrated care system at that place level, which is quite exciting. Given the nature of the place boards, which were the ones that I mentioned, which are more NHS focused, Norca won't initially be attending them, but what we will be doing is that there will be one adult social services person that will go, and we'll make sure that we keep Norca and membership updated on what's happening there and the discussions that are taking place. So then from a final perspective in terms of attending those partnerships, adult social services, we've got a few officers that will be supporting each of the partnerships and the place boards. And so we're going to be doing things like briefings and keeping colleagues up to date on what's happening in them. And so we've agreed with Norca that those officers will also support them in your representation at those meetings as well. And we'll provide them with the same briefings that we provide our directors that are going from adult social services. And there will obviously be occasions where that briefing has different information depending on if there's an internal sensitivity, but by and large what we're trying to do is have one voice together. So that is really it. I guess, Christine, I'll hand back to you, I suppose, if you think there's anything else that we might want to highlight. But it feels like a lot of what I've just talked about feels like structures, but it's actually really important about the role of social care and care providers alongside health in a different way to we've done before.
Thank you very much, Nick. It was really helpful having that representation as well, that diagram as well, to explain how it all fits together. I think it can sound terribly theoretical, and as yet we're still forming, really, aren't we? Because it is new from the 1st of July, as Nick has said. What we have, as Nick quite rightly says, has been talking about how to get social care voice in the groups as much as possible, and we've been doing a lot of work around making people aware of what this means, encouraging people to join us and so on. So we have had interest. We've got 2 providers that are on 2 of the health and wellbeing partnerships, one in the west and one in the north. I attend Great Yarmouth and Norwich, and I'm also on the ICB ICS. Megan goes to Breckland, Broadland and South, and we have somebody on the north as well. So the only one that I don't know about is Waveney at the moment, but there's obviously they're the 7 in Norfolk. We are keen that providers do get involved, and I think we just need to make sure that we make people aware of what it is, because at the moment it still seems quite theoretical and that the meetings are very formal. So until people are really interested and understand, I think it's going to be, let's see what happens, we'll report back. But I would like to say, and to anybody sitting here today that thinks, oh, that sounds interesting, I might just be able to give up some time to attend, please let us know. Or if you'd like to talk a little bit more about it with us, what it involves, what the commitments are, and also really about supporting the messaging, because like Nick says, one of the things we're trying to do is have an aligned voice here of social care, because it's really important that social care is seen as a system partner of equal value. So we're trying to get work with Norfolk County Council as well to get a really clear steer and direction for social care in the ICS. I think that's a sort of fair summary, really, isn't it, Nick, of where we are?
I'm just going to say as well. Oh, Phil, could you put yourself on mute?
Sorry.
We've got some background. I'm just going to say as well, if there are any providers on the call from the Great Yarmouth area, that is the one place so far that I haven't been able to find a provider representative. So if you can, and if you are in that area, do let me know. It's just another plea. I popped it in the chat, but I'm also saying it out loud. Please email me.
Thank you, Megan. I do attend anyway, so we have got it covered, but we are really keen to have a provider, and I can support them, Megan can support them, we can support them from Norca as well. So, and Suzanne, you have your hand up.
Yeah, I was just sort of adding to that. I think one of the things that we will want to really look at how we can support as well is around the provider engagement at a place-based level, because it is going to be a challenge to try to get all of the voices and issues identified. I think possibly next on the agenda we're going to talk a bit about the ICS social care quality program, and I think there is probably an opportunity through that actually to be able to feed back some of those issues. Is a fantastic opportunity for us because we have all the partners around the table, and so being able to have a clear agenda about some of the issues and get that forward, it will be a brilliant place to be able to do that. And probably in these coming months, a lot of the funding had already been sort of allocated and things, but I think going forward there will be much more opportunity about shaping funding decisions. Just thinking about sort of some of the things that have come up and some of the priorities around some of the feedback about some issues that we've got within social care. When we look at things like employment, when we look at things around affordable housing, transport links, those all do need to be discussed at a place level. And so I think that's where it's going to be really helpful to have a wide range of people as part of that. So I think it will be valuable for us to be able to effectively engage, but we probably do just need to think about, are there some better things that we could do, opportunities to get a number of those issues voiced and identifying. And I'm hoping that some of the research that we do through things like the care quality program might help with a bit of an evidence base as well.
Thank you, Suzanne. That's really helpful as well. But I think that at least gives everybody an overview of what the integrated care system is, because the last registered managers meeting, I asked everybody to put in the chat box what did they know what the ICS was, and not one person did. So it's still got to be socialized. People still got to understand what it means in daily practice. So it's the start really of the work going forward, but it is absolutely about a place where health and social care can come together to look at how we can support the health needs of our populations. So it will take shape over the next years. Okay, was there any other questions on that? And again, if people think of anything that they want to ask after the meeting, please drop us an email or just give us a call, and we'll hopefully be able to answer any of those questions. If not, I think it's over to you, Susanne. And I did think I saw Stephen arrive. I think he came in through the back door. Is Stephen there as well?
Yeah, I think Stephen's here.
Morning. Hi there, Christine.
Morning, Stephen. I did see you come in. So I'm going to send over to you, Suzanne, and to Stephen for your presentation.
Thanks very much, Christine, and thank you very much for inviting us. I think probably most people know me, but I'm Suzanne Baldwin. I'm Assistant Director for Workforce Care Markets and Brokerage. Stephen, I don't know if you want to just introduce yourself.
Yeah, I'm Stephen. I'm the Senior Quality Monitoring Officer, so I manage the Quality Monitoring Officers for Norfolk County Council.
And apologies from Tim today. Unfortunately, Tim is unwell and so hasn't been able to join us today. So I'm just going to share some slides so we can just sort of go through. I know a number of you joined us at the care quality session last week, which was fantastic. So I don't want to spend too much time going over old ground, but I will just do a little reminder for those people who aren't aware of the work that we're now launching. But I will also just provide some feedback as well from that, and then I think an opportunity for people to ask questions just more generally could be on any issues around quality. So I'll just share my slides. And so firstly, just to say a massive thank you to everyone who did attend last week. Sorry, just trying to talk and negotiate that, which wasn't going very well. Right, I can see everybody and hopefully you can see the slides. So yes, massive thank you. 90 providers attended, which was absolutely amazing. So just to give us a quick overview, I think everybody knows that the position we're in Norfolk. We're about, fortunately, we have just dropped again, but in overall terms, we're 70% of our care quality is good or outstanding, and we want to get that to 85% over the next couple of years. We are below our neighbours and regionally and also nationally as well. We want to get up to 85%, which would take us just above average. I don't think we think that there is any massive reason why we can't do this. And so what we want to have is a really collective view about, really open, honest view about actually what it's going to take to get there. When you actually look at the numbers, it's not quite as unachievable as it might sound. So I think it is sort of breaking it up and just really collectively working at this. And as I say, we can sort of see that that's an issue across home support, residential, and nursing. Interestingly, and I think this is really interesting when we start to look at this across the county, and some of you will have seen this before, some of the variation that we see, and I think that starts to give us a bit of a clue about the sorts of questions that we need to ask and understanding why. And this has sort of led to why we want to have this programme of work, which is looking at this from a number of different lenses. And there was some great feedback from people about, other ideas around evidence and things that we ought to look into as well. But, the sort of questions about, well, is there some different support models around nursing in the Norwich area compared to what we might see in the East? What are some of the variations around home support in North, where we know that there are significant workforce issues? So potentially you could have expected that might be lower. So there is various things then about, well, actually, is that to do with the type of work that's being commissioned, the price that's being paid, all sorts of things that genuinely need to understand. So this led to us looking at this from I'd say a number of different angles, starting with obviously care providers and the workforce, because obviously quality improvement and sustainability needs to be driven by the care market. But let's build a programme around that enables that to be a very strong voice. Then also looking at, I think there's a view that we don't have a really strong depth of feedback loops, a systematic approach to feedback across Norfolk, both sort of from an independent point of view, but also thinking about how we are having consistent levels of engagement and feedback from people who are actually in receipt of services, their families and carers. Having a close look at how we commission in Norfolk and our contract management. We need to make sure that we're setting the right quality expectations so we can hold to account, but also, it needs to be effective and fit for purpose and supporting quality improvement. Looking at the quality monitoring and improvement work, so making sure that we're delivering that through the proactive and collaborative work that's been set in motion and how we continue to support and sustain that. health services to support care provision, and that links to some of the work that we've just been discussing around the development of the ICS, and great that we've had some really good engagement on that. Yeah, we know we need good quality health provision to be able to support social care, but also we need to make sure that we're working in an effective and joined up way as well. So thinking about ensuring that we're well connected, looking at when we've got health functions being undertaken within social care, how is that supported? Have we got the right training? Are people understanding the needs? And that was interesting as well with some of the feedback, particularly around mental health needs. And then developing this quality culture. And I think this is probably the least formed part of this programme of work. But I think it's that view about how are we making sure that all our interactions count? How is quality everybody's business? And how are we supporting a sort of really proactive approach from everyone involved in social care? So this is sort of the programme. So this is a bit programmy, but just highlighting that we've got, and apologies, it should be an integrated care system at the front of the Social Care Quality Improvement Programme Board. It's sitting very much within the ICS, so really great engagement from partners across health. What we wanted to say build is make sure this was being led by individuals from across our system. So provider improvement work stream will be led by Norca, and part of the discussion when we met at the session last week was to look at those terms of reference and exactly what we want to have delivered from that. Then we've got the care market development projects that are critical to this, but part of ongoing transformation. So not anything that is new as such, but the implementation around the workforce strategy, our digital transformation programme, and obviously social care reform, and particularly fair cost of care as part of that. Alex Stewart from Healthwatch Norfolk will be leading the work around individuals, families and carer feedback. Mark Burgess, who's director within the ICB, and Nick will be leading the work around health services to support care provision. Gary Heathcote, our Director of Commissioning, will be leading the work around commissioning practice. Tim's leading the work around the integrated quality improvement. And then we've got a still to just be defined and agreed lead for the quality culture, which is a really important feature of this, but I suspect will be a little bit this is about how we make some of this really sustainable and stick. So we're now just interviewing for a program manager who will support this work, and really excited about getting this off the ground. We've got sort of terms of reference from the program board agreed. Obviously, this has also been agreed through Norfolk County Council's cabinet. I think it highlights the level of importance that everyone is placing on this, and I hope it will enable us to have a really structured way of approaching this, but really joint ownership as well as part of this, with some sort of setting the steer for how we work going forward. So just to highlight some feedback from the webinar, firstly, just to say the individual feedback, so that the more granular report will be circulated today to everyone, so you can see that more detailed comments. Some of the key recommendations from the session: recruitment workforce, was a key issue that was raised and went the whole way through the session, really, in terms of staff recruitment and retention. A view about the quality training packages available for providers to offer staff, and I think focusing as well on some of the more specialist training that's needed. I think sort of probably picking up on things that Stephen has raised previously in terms of from the PAMS reviews and feedback from CQC about training. That open dialogue with commissioning, and there were some specific points in there around how to improve commissioning, things that we need to think about to try to promote better quality, and views around some of the benchmarking that would be good to be able to do to really understand in a bit more granular level, a place level, but also comparing CQC results and PAMs across ratings and across sectors, looking at where we've got potential variation. We also had a really great discussion about feedback and some of the best practice, and there were some fantastic examples from individuals about the work that's being done and how that really feeds into continuous improvement within care provision. But thinking about some of the things that we could do, sort of recommendations to use some of that, things like you said we did, framework, how we can put in place some of the best practice around there, and ideas about an app as well, and how we could use technology to make it easier to get feedback from people, and also to give opportunities for anonymous feedback as well as part of that. I mean, there's lots and lots of detail around that. I mean, some of the things I just wanted to sort of also quickly sort of feedback on, as well as sort of talking about the recruitment and retention. There's a lot of discussion around branding and obviously the challenge that we've got with competition. I think this is where I'm quite gonna say it wrong again, Christine, but the care workforce framework. I've probably said that wrong.
Care worker framework.
Care worker framework. Thank you. I will get that right. I've moved away from pay framework, so that's good. But I think that's where things like that are going to be so critical and so important with some of the next steps that we need to take as a sector, because it is really about bringing it down to the skills, being able to demonstrate that value and make that case. So things around commissioning, which I've mentioned, around questioning appropriateness of things like welfare checks and how we have more time for visits, making sure that we're targeting quality. Lots of comments about the e-care records, and obviously that's something, we've now been given some funding to really be able to support the care market in driving that forward. And I know you've had some previous presentations on that, but that will be something going forward, and lots of people were saying that made a real difference to their business in being able to demonstrate that. Equally, I think there was still a little bit of a challenge, although hopefully shouldn't be part of CQC strategy going forward, where people were saying was a bit of needing duplication because needed to demonstrate things as a paper-based record. But Stephen will be able to give some more information on that. But I know it's definitely CQC's intention that there is they're supporting that use of digital records going forward. Mental health needs came up a lot, and I think that was a real sort of question about actually how we're seeing a shift in some of the needs, impact that has on training, but also I think a question about the wider availability of services to support both individuals and people providing social care as well. And I think that will be a really interesting theme that is developed both from the provider-led work, but also from the work that Nick's leading around health services as well. So I think there was some really useful elements to sort of think about how we're prioritizing and focusing on some of the next steps. As they linked to that was some questions around sort of high risk referrals, sort of information people get, but that links to some of the join up and this sort of recognition that change isn't easy, and actually the sort of support that we need to have in place as part of that. As I say, that the feedback will come around today. There's lots of stuff in there which was so useful, and thank you for everybody's engagement as part of that. So next steps, that will be reported back to the programme board. We've got so the provider-led programme is going to be part of that quality framework, as you've seen, led by Norca, and then the culmination of this will be both a strategy and improvement plan, but also some of the sort of we'll call it products, but things that we will need to have as part of this. So linking it to the training, linking to things such as ethical commissioning. So making sure some of our policies and practices are fit for purpose. But the aim is that we end up with something that is sustainable going forward, really helps long term to monitor some of this and directs future practice and policy. So I think that's all I just wanted to say on where we are, but I'm really pleased with where we've got to in a very short space of time to have this programme sort of up and running, and say once we've got a programme manager in, I think we'll be able to really push that forward. Then just wanted to highlight, Stephen will come in here, but I think it's maybe just useful just as a reminder on some of the things that continue to be some of the trends, and I'll go and just some of the useful resources that there are as well. Stephen, did you want to just do a quick update on that?
Yeah, of course. Yeah, I just wanted to highlight, because I attended a register manager meeting on the 13th of July. But I just wanted to identify, obviously, my team would go out and do PAMS audits, and we do quality monitoring visits, and I think it's important for us to share the trends that we see to support the market, and that's best practice, and just identify trends where we potentially can improve as a whole in Norfolk. The one thing that's really pleasing to see, and as I think we wanted to recognise again, is that with better security and better care, Norfolk are 71.55% compliant compared to the national figure of 53.40. That's probably gone up again.
It's gone up, Stephen. You missed it at the beginning. Pete provided the latest figure, but it has gone up. Yes, we're very pleased.
Which is amazing to see, and well done to everyone that has been involved in it. It is a great achievement, and like Susanne just put in the chat, so well done. It's amazing to see. And I think just wanted to highlight again that the quality monitoring officers are there to support you around your quality journey. So please make sure that you do utilise them. They are a supportive measure, and ultimately we're trying to achieve exactly the same end goal, which is to improve the quality in Norfolk. And we can support recruitment, training, especially on MCAs and safeguarding. I think things that we are seeing is still people are hesitant around MCAs and safeguarding. So again, just if you need extra support, just please contact us. And the kind of the main theme that we keep picking up is just the importance of governance. So I know that we live in a world now where recording is crucial, especially when it comes to the regulator as well. So making sure that you do record and that you do check it, so that you audit your home, especially as a register manager, and that the checker is checked. So what we are finding a lot is that audits are being done, but they're not being checked higher up by senior management. And therefore, no trends are being analysed from it. And the importance of action planning. We've got resources available that we can share with the market around action planning. So the importance of action planning, because there's always room for improvement, but also to recognise best practice. And just as a register manager, how do you reassure yourself that you've got oversight over your setting? And the second slide is around useful resources, so that will link you to good and outstanding care. And also CQC, Knowledge Anglia is an amazing website resource. If you haven't used it yet, please do. But also that's got our details on there and CQCs. And I'll put our email address in the chat as well, because that's our main kind of, if you're not sure who the QMO is, because we have had a slight reallocation because we're growing our team. And by the end of September, we'll have 14 quality monitoring officers to support the market. So the biggest the team has ever been. But I'll share the general email inbox that you can contact us on.
And we'll make sure those slides are circulated so you've got all of those links, because I believe Stephen's saying certainly on the Knowledge Anglia, there's lots of links to templates, best practice templates that can be used to help with some of the recording and sort of expectations that CQC will have. I think there's a hand up from Jane.
There is. That's from Jane.
Hi, I just wanted to ask, what are you practically doing? What is social care doing? Social services doing practically to support residential care better? You know, what about having link people so that each home has a recognised person or something? I've really struggled to get hold even of getting support from duty to support some residents when they're in a difficult scenario. And I just think that, you know, a lot of what you're suggesting is obviously on paper based and having the support, and you've had great things, but it's the practical support that I think there's a huge gap and could improve. Not many of our residents have named social workers to support them in their difficulties. You know, we have to go through duty, and sometimes you can't even get hold of duty.
Thanks, Jane. Yeah, I mean, it's in terms of the integrated quality service, there should be a named person for that. But I understand what you're saying around, you know, it's about the sort of practical sense and side of things. And I understand, you know, and that was something I think came out last week as well, about providers sometimes feeling a little bit isolated within the system, and whether that was about being able to get the right links to social care or the right links to clinical professionals. It was, you know, sometimes very challenging. So I think that's a really important point actually to take forward, that clearly, as you say, there is the emergency duty team. Yeah, that is a 24/7 service. That's not necessarily the same as sort of having some links. And I do think it's a important point that we need to consider how we can manage that more effectively to make sure that there is more join up as part of that. So I don't quite have the answer, to be honest, at the moment, Jane, because I can see that it isn't going to always be very easy. So I think, you know, it's something we need to sort of take on board and actually think a bit more about actually how that is feeling when there are particular issues, who the links are. So from a health perspective, obviously it will mainly be through the GP lead, and that would be where the you know, named person should be. But I think we could have to do much more around actually clarifying exactly what those routes are, so it's crystal clear for everybody.
I think the failure is quite significant in lots of areas. You know, we are chasing funding that was promised to support us in a difficult situation in January, and we're still chasing it. You know, and I keep giving it, that takes up a lot of my time, chasing resources that should come automatically, and I get a raft load of excuses as to why we still haven't got that money, which we were given when somebody had been mentally assessed as needing to be sectioned, and yet because there's no available room, we have to manage very difficult situations. We put in additional resources with the support of yourselves and funding agreed from it, and yet months later we still don't have that money. We're bankrolling. A lot of small businesses are bankrolling government organisations. We shouldn't have to do that.
Can you email me? If I put my email in the chat, can you email me, Jane?
I'm really sorry, but for some reason my chat box, I think I've used up my minutes in the chat
I'll
box.
send an email across copying you both in.
We've got your email, Jane. We'll pass that on to Suzanne.
Megan's going to link us out. That's fantastic. Thank you, Megan.
Silly things like that, you know, it is the interface, I think, that really matters. And I agree, having the policies and the procedures and things that you have and support is very helpful, and to support with training. But I think it's the practical impact that we need to get better, and that's how we support residents better.
Thank you, Jane. Thank you. Suzanne, yeah, if you have any issues with the email, we can pick that up. Megan and I'll sort that out after the meeting. And I noticed, Raj, you've got your hand up, but Megan, is this meeting meant to end?
At 12, our meeting
at 12, so we've still got plenty of time. Great, because I think it's really important we have a good discussion on this. Raj, do come in.
Yeah, I think I sort of made this point the other day. I feel like there's been a whole culture change within the local authority, and particularly the quality assurance team. And the previous person was talking about support and things. If you'd asked me 18 months ago, I would never have picked up the phone to a quality assurance officer and told them that we had a problem with something. I would never have encouraged that, because it was almost like, you've done what, you know, but yeah. And I felt that everything's changed. We've got back to that point where we can actually say, look, we've got this problem, we've got this issue, how do we deal with it? And it's a non-judgmental sort of assistance that providers are getting. And I've you know, I'm 20 years, I've seen so many quality assurance officers. They've all come and gone, different people at the top, and I think we've got a good support team. And if providers can make that call to their QA officer, if they know who they are, get to know them, they'll get fantastic support, because the culture has changed. And I think, and again, Christine, you can close your ears, with the advent of Norca over the last sort of couple of years, you know, again, if providers want that support and got questions, you know, it's there, it's available. And I've just found that in the last year, it is actually so much easier to drop an email if you don't know the answer, or if something's wrong or not, you know, that you're in trouble with something, drop an email. I don't think people are judgmental like they used to be. CQC is the only one that I still sort of have battles with, but I think locally we're doing a great job, and the people, you know, the quality assurance team, Norca, the local authority, all working well. So get to know the people there and communicate with them and get things resolved. And I think the quality issues will improve if we're all open and have that culture, which we're fast heading towards.
Thank you, Raj.
Thanks for those
and
comments, Raj.
Yeah, very, very positive and really good to hear as well. But again, like you say, it's really important to be able to have that feedback loop and to be able to express a view, whether it's positive or negative, but to be able to express it, to be able to discuss it and to get feedback. And that's what we've attempted to do. And I think, like you pointed out, it has definitely improved over the last year or so, but that doesn't take away some of the real issues that Jane raised, which was not necessarily about that, but the support around it, almost like the wraparound support that may be missing or not available at the time, which we must never forget either. But that's really, really good of you, Raj, to make those comments, and thank you for all the support that you've given as well, because you've been fantastic as well at promoting things for on behalf of us as well. Thank you. Was there Claire? Can I bring you in, Claire? Because there you are, Claire. Because you made a comment, and I thought it'd be really good just to hear it. So, please come in.
Again, just similar to Jane's experiences, really. We tried to get in touch with the person that's sort of on call, you know, tried to get through to social services for extra support for one of our people. Had to leave messages, no one got back. We've consequently managed to speak to somebody, and an emergency package was put in for him, and it sort of all suddenly ended, and nobody had followed through with it. Nobody had said, you know, has it helped? What do you need? Are the issues being dealt with? What do we need to do carrying forward? It was just suddenly stopped out of the blue. And we had to again spend a lot of time on the phone and chasing that up. And also similarly in the beginning, getting his care package right, though it had been agreed, the money never came, in a similar way to what Jane was saying.
Is this, can I just ask Claire, is this continuing healthcare funding? What
No.
particular funding is it?
It's Norfolk County Council, so, you know, adult social care for adults with learning disabilities we support.
Okay, and so it's a specific funding from Norfolk County Council?
Yes. Yeah.
Okay, so I think I don't know, Suzanne, you'll be able
Well,
to answer that.
yeah,
would
I
you?
mean, again, Claire, I mean, I'll put my email in the chat. It would be really good to have the example, because then we can actually sort of follow it through,
Yeah.
and that's how we can work on things which will improve that. So, I mean, I'm never going to sit here and guarantee that there won't be issues, and so not making excuses, but we also have some considerable workforce issues across our social work teams as well, but that's not an excuse. So I think it was really good though to get the specific examples, as say, because then we can actually work it through and actually try to ascertain was that one of whether sort of particular issues, or actually is there something more broadly that we need to look at. And we've got various pieces of work actually happening across the department at the moment, which is looking at some of the improvements and how our teams are working. So be brilliant to feed into that.
Yeah, and I completely understand that everyone's under pressure. I do understand that, and I know everyone's stretched to capacity with caseload. So. And when we've been able to get in touch with people, it's been really good, but it's just getting to that point at times. I know everyone's stretched, so I do appreciate that.
Thank you, Claire. That's very, very helpful. And just to reiterate as well, Claire, you can always bring this up in the subgroup, the NORCA subgroup as well. And what we do is we take up individual issues as well, and make sure that you're connected with the right people. I do think, though, we do need to make sure that the loop is closed, and that even if it's a negative response, that you know where you are. So we will definitely, we do definitely pick things up as people go along. Absolutely happy to do that, Claire, in those subgroups.
Okay, thank you.
All right, but thank you, Claire. Thank you, and hopefully we'll get some kind of result from this. So thank you for raising that. And we've got T Carver here. We have the same problem, not funding issues, but lack of response from the duty team. The most recent request from last Thursday was answered yesterday, and only because we contacted the individual GP. I'm sorry, I have to leave now. Thank you, T, for raising this. But these are the sorts of issues that we just need to bring to the fore, so that people are aware, because there are system pressures, and much as we can do to improve, we do have to recognise that this is what providers are dealing with, and find solutions, or find ways of supporting providers that are in very, very difficult situations sometimes.
Raj, you have your hand up. Did you want to come back in, or was that a legacy hand?
No, I did want to come back in. So, just going on from before, where providers have got this sort of point of contact with, like a QA officer, that they can build a relationship with. I'm seeing the same sort of issues. People are saying about funding and social workers and duty teams and things. So where providers don't have a specific point of contact and you've just got a duty team, there is no responsibility for anybody to deal with that inquiry. And I think in the same way, if sort of in the east or north or west or south, you had a person that was responsible and you knew who your social worker lead was, that all queries could go to that person. And I think in the same way, like with the QA team, if you know who your officer is, those queries can be directed and resolved by a responsible individual. And I think there's lessons got to be learned there, that we can definitely do that. I mean, I appreciate it's a people issue and we're all short of staff and they're short of staff, but surely even in the duty team, somebody could be appointed, North Norfolk, East North, and then everybody in that region knows who that person is. That if they've got an issue with funding, then they can go to that one person, have their email address, have their phone number, have their name. Because I think, Christine, there were a couple of things that I was trying to get sorted out, and I was going around in circles. I think you eventually managed to get me in contact with the right person, but it took me weeks to try and find that, and it was only coming to you. I thought, what? Maybe you know, which you did. But even then, I think you had issues trying to find the right person.
Yeah.
And I think we need that point of contact from the social work team. It just seems to be a sort of alias almost.
Yeah, thank you, Raj. And there's a couple of points in the chat box here around non-payment. Caroline, the contracts have not been completed are also an issue. The longest we went without payment was 10 months. And yeah, we do. These are issues that do need to be supported and resolved where they can. Waiting 3 months is long enough. 10 months is very difficult. And Raj, you're saying here also too much of options selecting before you can get through to the point of call on calls to the centre. This was raised at our safeguarding discussion as well. So there is something about identifying people and having call numbers that can get through to the relevant people. That would be really helpful. And just as Megan has said here, we can feed back at NORCA and JCF as well. JCF is the Joint Consultative Forum, and that's where Norfolk Care Association meets with the Norfolk County Council senior managers to raise issues of concern, but also to discuss about what's happening in the sector and feedback from the sector. Exactly from meetings like this, but other meetings as well are the subgroups of NORCA as well. Yes, Suzanne, thank you very much for your support of Caroline. I don't know whether, Caroline, you can come in, but I just going to ask if you could come in briefly, and we'll make this the last last discussion point. Caroline, are you able to come in? Don't worry. Oh, hi, Caroline. Hi, come in.
Hi. Yeah, we have this as an ongoing issue. Up to last week, we had 6 clients that their contracts hadn't been completed and we weren't being paid for. We have some really complex people in Norfolk, and their weekly fees can be in excess of £1,000, and to go with 10 months at £1,000 a week and not get paid because nobody knew who was doing what, or the social worker had left the department, they hadn't filled out the contract. The excuses can be wide and varied sometimes.
Thank you, Caroline. And as Suzanne said, if you pass your email address to her again, she'll pick that up. Thank you, Suzanne. Thank you so much. Thank you. And sorry, just really quickly, Jane, you've got your hand up. We'll have to make this the last point.
Oh, thank you so much. It's just a quick question, really. So I'm fairly new to the service. We're just under 6 months, and you've just mentioned safeguarding, and I'm having terrible problems logging onto the portal. I've asked our IT department to have a look, and I think it's because I shared the same email address as the previous manager, and I just wondered if there's anyone else that had these problems, because at the moment I'm calling everything in. I just wondered, I don't know
if anybody else has got any issues of. Funny enough, we did discuss the online portal, and everybody was saying how useful it was and how easy it was to use. So I'm wondering whether or not this is a specific issue relating to your IT. I'm wondering whether or not it would be useful for you to contact. I think it would be fair to say Walter, who could then work out who to contact in his team. So Walter Lloyd-Smith, have you got his email, Jane? If not, we can pop it.
I don't think so.
It's okay. We can pop it in the chat box. I think it would be best for you to contact him and say you've got this issue and could you have some help to resolve it?
Okay, lovely.
Sounds very much like an individual issue though, Jane. So maybe we can sort that out. But yeah, let's try and do that for you.
Lovely. Thank you.
All right. Okay, lovely. Okay. Oh, we've got everybody. Oh, we've got a flurry of activity. Okay.
Sorry, me and Pete were racing to put Walter's email in.
But this will be the last person. Jessica, you've come in and you haven't spoken, and I think it's really nice to hear from people that haven't spoken before. So Jess, do you want to come in?
Yeah, hi. It was just to sort of reiterate what Jane said, because I don't think that this is an individual issue. I took over as manager here a few months ago.
Okay.
And I'm obviously using the same email address as a previous manager. It took a lot of sort of toing and froing between myself. I contacted the duty team. I went to the IT team for the portal. I eventually managed to get it changed so that I could log in, because obviously you need to have a text message in order to verify yourself. But that still has the previous manager's name on the account, and I've asked for about 3 months now to have it changed, and that still shows up as a previous manager, and nobody seems to know who it is.
Okay.
That's dealing with it.
Okay, then, Jess.
That was just to sort of support what Jane was saying, that I think it needs to be a lot clearer how to change that.
Okay, Jess, I think we picked up what the issue is. It's a change from the previous manager. It seems to be a common theme here. So again, Jess, if you could contact Walter, Megan, perhaps you and I at the end could just get in touch with Walter and see what they can do their end, just sort of follow it through as well, Jess and Jane. And I think if you keep in touch with us, if you've got continuing problems, then we'll chase it for you. Is that okay? Yeah, good.
That's lovely. Thank you.
Thanks, Jess.
That's lovely. Thank you.
That's okay, Jane, and that's okay, Jess. So let's try and get that resolved for you. Thank you. Thank you. So Suzanne and Stephen, was there anything else that you just like to add at the end of that before we go on to our last little bit for the meeting?
I don't think so from me. Thank you everyone for your comments, and yeah, give me a bit of food for thought as well about some of the things that we might need to think about internally about how we're say making it easier for people to be able to contact on some of these things, because I can see that it must, you know, as an officer within the council, sometimes it's hard to work out who to speak to on various things. So I am feeling your pain on how, depending upon the particular issue, it must feel difficult to be able to get to the right person. So yeah, no, really helpful, and be grateful for, say, some of those more detailed issues. Just if someone can just email me on those, that would be great, because it's really good to get specifics.
Thank you, Susanne. Thank you. And Stephen, is there anything else you wanted to add?
Yeah, from an integrated quality service, just wanted to say thank you for all the lovely feedback. And do utilize us. We're a free service that can help support you in your quality journey. And ultimately, we want to get there before CQC do the regulator. So if we can support you to maintain quality or improve quality, then please utilize us. And thank you for the lovely feedback.
Thank you. And just one quick question, which we may have to take over, but has a scoping exercise been done to look at care providers who may not be able to survive the current financial crisis? What will the future capacity for social care? What will be the future capacity for social care in the ICS? Julia, I think, and again, perhaps Susanne, you can answer that, but I'm thinking of that's the fair cost of care exercise and the work that Julia Phillips is doing in terms of market positioning statement and all of that.
Yes, absolutely. It will be part of that. We do also look at provision as well, and try to sort of identify where there might be providers who are at risk, to enable some of those conversations with some of those providers. We obviously also encourage anyone to give us a call to discuss any particular concerns as well, so that we can have a look at that. We've also said that we will, over the next month, run a couple of social care reform sessions as well, just to give people a bit more of a thought, because you know, I'm you know, not going to lie, I think that, you know, this will be a big change for us within social care as part of the reforms, and it will have a particular impact on some providers depending upon your business models. So I think that is yeah, that is a fact. There's a really good Languison impact assessment that's available online, and that's quite a useful read for providers as well to just have a look at. But it does highlight, depending upon the types of individuals you're supporting, some of the variation that might be seen through social care reform.
Thank you, Suzanne. Thank you. Okay, so thank you very much, Suzanne, and thank you very much, Stephen, as well, for attending. And we will get back to Nick, who might have gone before I actually thanked him personally, but thank you to Nick as well for attending. Megan, can I just hand over to you for the last part?
Yes, you can. So we're going to do a Mentimeter just for our last part. As you know, we do love these, me specifically. So I've popped a link in the chat and I've also popped the code in. But if you are tech savvy and you have your mobile phone on you, you can scan the QR codes that should be on your screen now. I always feel like I'm in a sort of a weird TV thing when I say things like that. But yeah, so if you just scan the code that's there, if not, it's www.menti.com and enter the code 11930243. I can see we've got some people already coming through, which is brilliant. I'll just wait to give you all a couple of seconds just to get through that. That's brilliant. And just make sure no one's got any issues accessing it. Lovely. So I'll go across to the next slide then. So you're going to be prompted with this question, which are, what are the barriers to you taking on a trainee nursing associate? So it's a free form text box, and if you just complete in there if there's any barriers at all to you taking on a trainee nursing associate, and we should start to see the answers come up.
And just to give you, I don't want to prompt availability. Yeah, I don't want to prompt, but it could be finance, supernumerary hours, don't know about it. All of those things.
We've got a few coming up, but good, nice that none. So that's good. Availability, supernumerary hours, capacity, logistics, time to set it up, understanding the role in dom care. I think that's meant to be. I'll just give everyone a couple more seconds to complete that. It's really helpful information for us because then we know sort of how to pitch the information that we send out as well. So if we know what some of the issues are, then we can obviously look to address those and give you the information that you need. Specifically, I'm seeing a few on here that I'm sure Phil will be able to answer, even just having a look at those, so we can sort of address our comms accordingly, which is really, really helpful.
I mean,
would like more contact. Sorry, Christine.
Yeah, I was just going to say that don't know about it yet. Whoever wrote that, if they want to get in touch with us, we're very happy. Phil, in particular, would be very happy to talk through what it is and how it's set up or how it works. I think the point about how it works in dom care, we're having our first trainee nursing associate from a dom care provider. So we'll be learning lessons as we go along with that. But they've gone through the modification process with the UEA, and so they're on board the programme, which is fantastic. So it's happening. It's happening.
Brilliant.
I'd just quickly come in as well, Christine, and just say a lot of the questions that we see here are the questions that we get asked quite regularly. So the providers who have put these questions in are the types of questions that we get asked so often, and we're able to help and steer you through these, no problem at all.
Thank you. Thanks, Phil.
Thanks, Phil. I'll go.
Sorry.
I was just going to say, I know we've only got a couple of minutes left, so I'll go on to our next question as well. Which is, are providers interested in international recruitment for Sri Lankan care workers? So there is a specific reason we're asking about Sri Lankan care workers in particular, and I'll just bring up the details of that. I know Christine sent them over to me yesterday. There we go. All best laid plans. There we are. So I think from what I understand, Christine, am I correct in thinking that it's joint between health as well?
Yes,
that they're bringing over, link up some care workers from Sri Lanka to supply adult social care. And they're looking at sort of a cost model around this and looking at how it might be supported. So if you are interested in recruitment into that area, do just pop in. Yeah, absolutely. That's what we like to see. Brilliant stuff. Sunita, I can send over some links as well. If you just want to, not at this time. Yes, no, that's absolutely fine. We're just really gauging interest at this time. If it's something that providers would be interested, and then we can sort of look at how best to communicate that out to the market. I know it's something that NCC have been in touch with us about looking at and looking into.
Really good.
Doing our own international recruitment from Zimbabwe. Oh, lovely.
Oh,
my godmother's
fantastic.
from Zimbabwe. It's a beautiful, beautiful place.
I've noticed Sunita in the chat box here as well. I think you were talking about TNAs, but also international recruitment. So can I ask Phil, could you contact Sunita to discuss trainee nursing associates?
Absolutely. Yeah.
And we'll keep a list of the providers that have said in the chat box they're interested around this, so that we've got an idea of who's already expressing an interest.
Brilliant. Thank you all. I think that's everyone that's filled that out, that's going to, and Suzanne's popped some much more important information in there. Much more conducive. I'm so sorry, my jaw has gone very funny all of a sudden. Let me just stop sharing that screen and I can pop in the chat, Christine, the survey as well for today.
Thank you very much. So if you wouldn't mind just completing our survey, it's just to get a little bit of feedback. There's only a few questions. Megan, you'll have to remind me. Is it just 3 or 4?
I think it's 3.
Yeah,
I think it's 3.
It really is very short, but it's really useful for us. So thank you. So if you could do that, that would be absolutely wonderful. Thank you very much indeed. And we'd like to say thank you to everybody that's attended today. We hope that you found it very useful. We've got some fantastic feedback in the chat box. So we know for some people it's been very useful and informative. Once again, from all the team, we're here to help you, and if you do need any support at all from any of the subjects that we've raised today, please do get in touch with us. And thank you so much for attending.